Well, good morning, everyone, and welcome to another Unison webinar. My name is Carolyn Curry de Castillo, and I'm the host of Unison TV. I'm very happy to have you all along and very happy to have us joining again. We have Dr. Josip Batinić. He is the co-owner and clinic director of National Spine and Wellness in Calgary. We had a chance of speaking to him last week and had a great conversation about treatments for osteoarthritis in hip and knee. And today we're moving on and exploring back pain 101. I think some of us, all of us can really relate to that at some point in our lives. Thank you very much, Dr. Batinić, for joining us. And we have Blair on the line too to help us facilitate questions and keep things moving along. And I just want to say welcome and thanks very much. And let's carry on and let's, as much as it hurts to talk about it. But let's talk about back pain and what we can do about it, and specifically that GLAD program. Take it away.
Sounds good. Thank you so much, Carolyn. Hi, everyone. My name is Dr. Josip Batinić. I was here a couple of weeks ago talking about osteoarthritis in the hip and knee, and today I will talk about back pain. Now, both of these presentations, they are based on the program called GLAD, which is stands for Good Life with Osteoarthritis in Denmark. So it's a program in Denmark that was adapted by Canadians. And now that program here is in Calgary in Alberta, and some of it is publicly funded. And I can talk about that a little bit later. But to tell you a little bit about myself is I'm a chiropractor. I am a graduate from the Canadian Memorial Chiropractic College in Toronto. I also have a Bachelor of Science in Kinesiology and Exercise Physiology from University of Saskatchewan. I became a certified clinical exercise physiologist at the time as well. And then I belong to all the regular associations of a chiropractor. I am certified in both hip and knee and back GLAD programs. And I volunteer for the Kidney March every year to bring awareness to kidney donation and organ transplant. I've also authored some articles here and there with the help of Blair, who is on this call at this moment. So my clinic, Momentum Health National Spine and Wellness, is one C train stop away from the Kirby Center. We are on 10th Avenue, a block west of Sunelta train station. So if you are ever in the neighborhood and want to pop by and say hello, you're more than welcome to. I can make you tea if you'd like as well. Okay, so this is how the Gladback program works, and then I will go into a little bit of a back pain, and if you have questions, and a lot of people have questions around back pain, just write them down or so that we can address them at the end here. But how about Gladback works is like this. Somebody gets a referral for Gladback. Or if they don't have a referral, they can pay for the program. But if they have a referral, that referral lands in my office, and then that patient is booked into my schedule for an assessment. And I meet that patient one-on-one. And what I do in that visit is I talk to them about their back pain, I examine them, and then what I do is I perform 4 objective tests on their back. And I am looking at their back flexibility in this first little diagram, as you see right here. We test them on abdominal strength, we test them on back strength, and we test them on their hip strength with sit to stand. And then what we do is we come up with a goal of some sort, and it has to be activity-based goal. So it can be a goal like I want to walk a little bit more, I want to get up from the floor, I want to use the stairs, etc. And then the idea is once you come up with a goal, you use the Gladback program to achieve that goal. And because this is a research project, these goals, as well as these measurements of these objective tests, that also we input that into the research, and then the research people look at the large sets of data to see, hey, how strong are people? And then what we do on the very last visit of of the glad back is we repeat those tests and we see where the people were to compare to where they are. And that also goes into the research so that the researchers can take a look and see, are these people getting stronger, basically. And then when this first visit assessment is done, then the person is enrolled into an education program, and basically it is 2 days. It is an hour to about an hour and a half, twice in a week. And then once they go through that education component, then they are entered into our group class for exercises. And there's two of us that teach this exercise component at our clinic, myself and Dr. Michael, who's another chiropractor. And Gladbach is very, very particular about these education classes. If people do not go through the education or they miss one, they cannot go into the exercise class. It's a full stop. So you have to learn what back pain is and what pain is to be able to go into the exercise class. So what I'm about to do now is I will deliver the first education component, and the second, I will not. I mean, we can certainly schedule that at some point in the future. But the second component deals with pain and why pain occurs and how do we deal with pain. But today, mostly what I will discuss is back pain, basically. And then this whole program is 7 weeks, and it is twice per week for 7 weeks. And the first week is this education component, but it's twice a week. Okay, so why are we doing this? Well, um, there's lots of people that have back pain, and we are finding that when people know or have knowledge about back pain, they can take care of themselves a little bit better. And then exercise is really key in management, long-term management of back pain. So the program is both. It gives people education and background on how back works, and then they go through the exercise program, which is twice a week for 6 weeks. Okay, so why do we have to teach patients about back pain? Well, there's a lot of conflicting information about back pain. If you think about it, if you've ever had a back pain in your life, if you talk to your relative, friend, your neighbor, everybody has an opinion. Everybody has, this cured my back pain or this and that. So there's a lot of conflicting information. The second point is when people have back pain, generally they are afraid to move because they think they're going to injure their back or strain their back even further, and it's going to get damaged beyond no repair. So we teach people that movement is really key when we manage back pain. So who gets back pain? Well, everybody really, men, women, people in all types of work, and people of all ages. Last week I saw a 1-year-old in my office, but I also saw a 92-year-old in my office. So we see people who are sedentary, who don't exercise. We see people who exercise. We see people who are retired. We see people who are students. We see people athletes. Basically, we see all kinds of people for back pain. In 1 year, 4 out of 10 people will experience back pain. So this is called point prevalence. So in a city of 1 million, for example, I know Calgary has more, but let's say it has a million, 400,000 have back pain. And the lifetime prevalence, which is how many people get back pain sometime in their life, is 80%. So 8 out of 10 people will have back pain sometime in their life. And my personal opinion is that those 20% that don't have back pain, they just forgot to do the survey, basically, because I think everybody has it. Okay, so who is at risk of developing back pain and who is more susceptible? So, well, people sometimes that do heavy physical work, let's say construction workers or drywall people, people that work in awkward positions. I once had a plumber who was changing a sink and then sneezed and then his back was pooched. There are also other diseases that contribute to back pain, and they are diabetes, asthma, and depression. Now, most of the reason why this happens is because it is related to inactivity. lots of people that that have diabetes or some form of anxiety and depression, they may not exercise and move as much, and that puts them at risk for developing back pain. And then smoking and being severely obese, again, that is also a link with physical activity or lack of physical activity. Sometimes people will have pain in other parts of the body. So let's say somebody has plantar fasciitis, and that's a pain in their foot. And let's say they walk a little bit awkwardly, they favor one side over the other. Well, before you know it, you may have some back pain. Or sometimes people they'll play tennis, they'll get shoulder pain, and then before you know it, they have upper back or neck pain. So sometimes other parts of the body can influence how the spine works. And then, as with the arthritis of the hip and knee, you can't really escape genetics. So sometimes people, if their mom and dad had a really, really bad back, sometimes they can also have a bad back. There is a genetic component. How big? Different for different people. And then stress or mental pressure, as well as poor sleep, can also influence back pain. Now, this is generally because of tension. So if you think about it in your own life, if you've had a deadline or you were stressed out or somebody passed away in the family and you have more stress in your life, you will find that your shoulders and your upper back and your neck starts to get tighter, you have a headache. And then tension is related to development of back pain as well. So the more things move, the more things are loose, the less likely a person will get back pain. But sometimes there are periods in one's life that where you just have more stress or more pressure, where you have a bit more back pain. So there's this thing called benign back pain, and benign back pain is really not dangerous. And 90% of all back pain, we call that benign back pain. It is benign. People don't die from it, but it can hurt like hell, basically. Benign back pain can also be called non-specific back pain. It can be mechanical back pain. It can be called common back pain. It can be called lumbago or lumbalgia. Basically, they all mean exactly the same thing. And most back pain that comes through my office, majority of it is benign back pain. But there are also other things that can cause back pain that are non-benign or non-mechanical, but most of it is mechanical back pain. So when you think about back pain, think kind of non-life-threatening pain, but it can hurt a lot, basically, and it can interfere with people's quality of life quite significantly. So, benign back pain, there's sometimes really two forms of it. So, some people can have absolutely zero pain, and then they lift, bend, twist, sleep in an awkward position, and they get a little bit of a pain right here, and that pain goes up. And this can be a few days, a few weeks, and then all of a sudden, that resolves, and they have no back pain at all. And then, a month from then, somebody says, "Hey, can you help me lift this couch?" And they do, and then they strain it a little bit, and then they have a little bit back pain, not as bad as last time, and then that goes away, and then they have no back pain. While other kind of subset of population with back pain is they'll have low grade symptoms all the time. They'll have stiffness, tension, and this stiffness tension can go into pain, be better, can be a little bit worse, can be a little bit better, can be a little bit worse, but it's always there, basically. So it can fluctuate in intensity, but it's always there. Versus the first graph here, where some people have zero back pain, and then they have a little flare up, little tweak, and then they have that back pain for a few days to a few weeks, and then it goes away. So anybody that has back pain or gets a flare up of back pain, most of this pain with benign back pain will improve within 2 to 6 weeks, basically, whether you do something or not. So sometimes people come into my office and they'll say, what do I need to do? And then I tell them, and they say, well, what would happen if I didn't come and see you? I said, well, in a lot of cases, all of this will improve within 2 to 6 weeks. But when people come into our office, we can get them within few days to a week, maybe 2 weeks, so we can shorten that time. But in a lot of cases, people back pain will resolve. In some people, it doesn't. In some people, after 6 weeks, they still have a lot of pain. They still have a lot of discomfort, and we see that with car accidents. So when somebody has a whiplash, they'll get significant pain, and then it will not resolve within 6 weeks in some of people. So they need treatment to get them to a point where they're feeling like before the accident as well. Now, some people will have some degree of stiffness and tightness, and then they will have a severe case of back pain. So let's say they have back pain that fluctuates between 4 and 6 out of 10 all the time. And then one day they do something that they haven't done in a while. Let's say they go for a long hike. Let's say they're painting their deck. Let's say they lifted a suitcase from traveling, and that sets off this major back pain that's 10 out of 10, and that is really, really painful and bad. But that also over time tends to get better, and then people will get back into their normal state of back pain, if you will. But the important thing is to note is this back pain does not really get significantly worse over time. So if we look at somebody with back pain, if we look at 10 years, it's not as if at year one they had some, and then now they have unbearable back pain at year 10. So it really kind of can fluctuate, but it doesn't get significantly worse over time. Now, this back pain, uh, well, the problem with the backs is it's very, very complicated. And the back pain can originate from structures known as joints. And in my glad back program, I teach everybody how many joints does a human spine have, and the answer is 364. So one less than a year. So there's a lot of area where things can go wrong with the spine. Um, Discs as well as cartilage can also hurt in the back, as well as ligaments can also hurt in the back. And ligaments, they bind bone to provide stability. Muscles, and there's a lot of muscles in the back, they can also hurt. And muscle and tendon, they work together because tendons bind muscles to bones, basically. So typically, it is not possible to determine where this pain really comes from. Now, you might say, well, what are you talking about? Like, I thought you're a doctor and you know your stuff, but how can you not figure this thing out? Well, I'll go over that, but it's not really possible to determine where the pain is coming from exactly. And sometimes that can be a clinical challenge if we are sending for injections of the lower back. Now, we don't like to send for injections right away. People have to go through proper treatment first, but if they cannot get better, sometimes we do to help. But the challenge to that is where do we actually inject into the back to help this person? And we can certainly discuss that a little bit later with the questions, if anybody has questions with that. So back pain rarely comes from one particular structure. Everything's really in the back is closely together and is intertwined, and it is a I don't want to say it's a black hole when it comes to the back, but it is very complicated. And back pain can originate from all structures, even when there isn't any injury or damage. Now, because this is a GLAD program and it is from Denmark, I have been told when I get to this slide to say back pain when there's no damage, it's almost as if somebody stepped on a Lego piece. They're having a lot of pain, but it's not damaged because Legos comes from Denmark. And that's all I'm going to say about that. So benign back pain can include pain from the back, from the buttocks, and from the legs. People also can have tingling sensations or numbness in their back, in their legs, in their thighs. They'll have restrictions on standing, sitting, walking, and bending, so they may not be able to sit or stand, or transition between sitting and standing, or they'll have a hard time sitting. They'll be frustrated, sad, and worried often when people have back pain. And then sometimes people will have anxiety about moving and insecurity about using their back because they think when you have back pain, if you move, you're going to make it a lot worse. So you don't want to move. People will also feel tired, and sometimes that's correlated with poor sleep. Because if you have back pain, sometimes you don't sleep well, and then you feel a little bit tired, and then that in itself will actually give you a little bit more pain as well. And then inactivity also contributes to back pain as well. So the more we move, the better things are. And then in my class, I asked the class if there are any other things that people experience when they have back pain. Now, the glad back has these key messages, and there's 11 of them, and I'll go over several today. And one of the key messages of the glad back program is that natural movements inhibit pain. And similarly to my talk with the hip and knee, um, when people feel pain, they feel pain from the pain receptors or nociceptors. But when they move, they stimulate mechanical receptors. And these mechanical receptors shut down these pain receptors. So if somebody has some back pain, they're getting signals from their back into their brain saying that you have pain. But when they start using that back and when they actually move or go for a walk, these mechanical receptors get activated and they shut down these pain signals. So people feel pain, and that's true for ankle, knee, hip, elbow, neck, and back, pretty much everywhere. And then people when they have back pain, many of them will move very, very rigidly and very, very slowly. And they think this is helpful, but not so. Movement can actually reduce pain. So if people have pain, go for a 10-minute walk and see how you feel. And if you feel better, fantastic. And in most cases, most people will feel a little bit better, even though initially they'll have some pain and discomfort. Okay, another key message of the Glad Back program is that the back is made for movement. So you wouldn't believe how strong the back is. I once had a bout of back pain, but I had to put a really heavy tarp in my trunk, and I did it. And after I did it, my back felt a lot better actually, but it was painful and it was quite a challenge to do that. The back is made for movement, and the back needs to have a variety of movements to be healthy. And people need to have a variation of movements of their back so that they feel healthy. Um, so just like the lungs are made to take in air and heart is made to pump blood, the back is made to move. And if you think about our, modern life of everybody sitting, we are not moving nearly enough as we should. I mean, some people do, but as a whole, we need to move a lot more because different movements are very, very important for well-functioning back. And these movements can improve joint function, strengthen bones, joints, and help reduce pain. I have a long-term patient that comes sees me when he has back pain, and I have a little stool in my office where when people come in, they can put their phone and keys in the wallet, etc. And this guy, I have never seen him bend down and leave that. He's always in a lunge so that his back doesn't move. And he is afraid that if he moves in a certain direction, his back will go into a spasm and then he won't be able to get up. So and I've been seeing him for like 15 years basically. So I have never, and I've told him and I've given him exercises, but he's just now I will not bend that way, period. But back is really made for movement. So to summarize this, back pain and mainly what we're talking about is benign back pain is very, very common, but it depends on several factors. It's not dangerous, but it can be very difficult to live with, and people can have a lot of pain. It comes and goes or varies in intensity, but really it follows a recognizable pattern. So when I see patients in my office, I ask them about, when did it start? How did it start? You know, what makes it better, what makes it worse on a scale of 0 to 10, where we're at. So really what I'm trying to figure out is where on the trajectory of back pain are they at? And which person are they? Do they have zero back pain that sometimes they get some pain, or do they always have more back pain? Because we treat those people just a little bit differently as well. Back pain rarely has an exact cause because the complex lumbar spine and back and pelvis and muscles and bones and ligaments and tendons and connective tissue, all of it is intertwined, and it can have cannot have an exact cause in most patients. People that have back pain, they don't really move well. They move rigidly, and sometimes I'll say, some people's backs they move. It moves as one big piece instead of several different pieces. And I said, like I said, 364 joints in the spine, and then in the lumbar spine, there's a lot of them too. But sometimes people move as is that it like their back is glued or cemented, and they cannot actually put motion into that back. So, um, so 90% of back pain is this benign back pain. But this other 10% of back pain can come from nerves or nerve root compressions. This can be caused by disc herniation or stenosis. What a stenosis is there are holes through which nerves exit the spine, and sometimes there can be a compression or narrowing of those holes. And if there is, then that nerve can get pinched. And if that nerve gets pinched or if that hole gets narrower, we call that stenosis. Some people that can have autoimmune diseases such as rheumatoid arthritis, which can give them back pain as well. And some people can also have bone fractures or infections that can also cause back pain. I'm going to get to imaging a little bit here, but sometimes when we order imaging for the backs, we order it immediately if there's one of three things. That is trauma, infection, or tumor. So if somebody has fallen, trauma, and we are afraid they may have a broken bone, we'll send for an x-ray right away, no questions asked. If we are suspecting somebody has an infection, they were sick, now they're in your office, they have a fever, they may have an infection, and then tumor. If we suspect there's an underlying tumor in the spine in the back that can cause people pain, but those are very rare, but they do happen. And then about 10% of all the backs is what we call this non-mechanical back pain, and I would say sciaticas are part of nerve root compressions. So I see a lot of sciaticas in my practice, and that would be caused by nerve root compression. So they come in. This is not a benign back pain. This is kind of we call that radiculopathies, which is nerve root compressions that causes a lot of pain into the leg. Okay, so this slide here shows. So there's four groups of people here. At the very bottom, those are 20-year-olds. Going up, those are 40-year-olds. A little bit higher, 60-year-olds, and then a little bit the top one is the 80-year-olds. So if we look at imaging, we have this purple is spondylolisthesis, and spondylolisthesis is when there's a slippage of one vertebra over another, and sometimes people will have that. Facet joint degeneration is basically arthritis, is one of the classes of joints in the spine. Disc protrusions. Discs are jelly-filled donut cushioning that absorbs the shock between the bones of the spine. So those are discs, and sometimes these discs can protrude a little bit. And then when you have arthritis of those discs, it is called disc degeneration. So basically, this slide shows different groups by age and what they have on imaging. But what this slide says is that all these people that have these findings, they really don't have any pain or discomfort. So sometimes we will see a lot of things on an image, but that does not necessarily translate into the person's pain, symptoms, etc. So I just want you to be aware that imaging sometimes is, um, I don't want to say useless, but sometimes it does not really help us in determining somebody's or diagnosing somebody's back pain. So all these people have a whole bunch of findings on imaging, but they have zero pain and discomfort. They can lift, bend, twist, play golf, travel, no problem at all. So that being said, imaging doesn't really show us where the pain comes from. I wish it did. I wish I'd sent somebody for an MRI and then I got an X saying this is where your pain is coming from, but that's not really the case. Imaging cannot predict what will happen with somebody's back as well. And imaging is not necessary to choose the right treatment. I had a patient in my office this week and said to me, "Hey, don't you need an X-ray to treat me?" I said, "No, I do not. Um, but if I needed one, I would certainly order one." But I did not. But imaging is not really necessary. And sometimes I will see patients that come and see me and they've never met me before, and they come in with their X-rays or MRIs, and they'll say, "Hey, look at this." And I look at it and I go, "Okay, how are you doing?" "Well, good. Do you have any pain?" "Well, no, but I need to treat this." So what are we really treating if we don't have any pain? And so sometimes people get hung up on imaging findings, even though that's not very necessary or helpful. So the back is quite strong, and this is another key message of the Glad Back program. Many people with back pain, they will think their back is very fragile and very weak, but it is really, really strong. I mean, when people do deadlifts, for example, some people can lift, over 500 pounds, no problem, and using their back. So really, you can trust the back to withstand a lot of strain, even when it hurts. So there's a lot of power there in the back. I get a lot of questions around this when I teach in person, and bad posture and spine deformities are quite common. A misaligned spine is common even in people with and without low back pain. Um, but back pain is not caused by poor posture. Now, if you see that and you go, wait a minute, like how is that possible? Just remember that if somebody is in a bad posture, but they move around to another posture and to another posture and to another position, that is really what people need to do. But if you are in the best sitting posture there is, and you're in that posture for a sustained period of time, for a long period of time, then you will get back pain. So bad posture does not cause back pain, but sustained long-term prolonged posture does. And then findings on imaging are a lot common in people that do not have any back pain whatsoever. So sometimes I will see patients that bring in their x-rays or MRIs and they'll say, we need to treat this even though I have no pain, and we don't really do that. So diagnostic imaging is rarely needed to treat back pain, and it really doesn't show us the cause of the pain as well. Now, these two pictures here, they show two guys who have quite a severe scoliosis. Yet both of them, and scoliosis is when there's a lateral curvature of the spine. But yet they're working out, lifting weights, having no pain, no problem. So some of these things are common, and yet they don't really pose any a problem to the person. When would this be a problematic issue? Is if the person is pre-growth spurt. We want to make sure that once they hit a growth spurt, their spines do not progress with the curve. So there's a lot of conservative and non-surgical approaches in treating scoliosis so that it doesn't get worse. And some of it is bracing, but a lot of it is exercise based. And we have two physiotherapists at our clinic that deal exclusively with scoliosis. So people that have scoliosis, they will come and see them, and then they will assess them, and in a lot of instances give them exercises, and in some instances order some braces so that the curve doesn't get worse. So some of the facts about and myths about back pain is, and this is all review here, a misaligned spine is quite common even in people without pain. Bad posture is common even in people without pain. Findings on imaging are common even with people without pain. Are you getting the drift here? Bad lifting techniques or incorrect sitting positions do not exist. So people will sit in bad position, no problem, and then switch to another position and then switch to another position. So these days, some people have sit and stand desks. So people that sit will get more back pain. People that stand will get more back pain, but people that transition between sitting and standing will get significantly less back pain. So really, um, the solution to bad postures is you got to keep moving around and sitting. You got to avoid lots of sitting at once. So I tell people, every so often, and this may be every 20 minutes, every half an hour, or every hour, get up and move around, go to the bathroom, get a drink of water, or just get moving a little bit, and that will significantly reduce back pain. Now, I do get patients that come in and see me and they say, "Oh, I have a slipped disc." So I know what that means, but that is not the case because discs do not slip; they herniate. So the reason why this is not the great um, vernacular is if people say, "Oh, my disc has slipped," they will come and see a chiropractor to put the disc back in, and that is not the case. So discs do not slip; they can herniate. But I over lots of years, people have come to me and say, "Hey, I have this disc that it's out. Can you please put it back in?" And that is not the case. Um, when it comes to back pain, medication is recommended only in short periods of time. I'm finding that lots of people will want to take less and less pain medications for their back, and they're always looking for, things that to do not to take pain medications. Now, pain medications are okay in the short term to kind of get you through the day or have a good night's sleep, but it's not the best for, your kidneys and your liver and your gut and all of that. And some people are on different other um, pain medications. So sometimes they want to take a little bit less. And because I am one of the volunteers on the medical side for the Kidney March, I sometimes see a lot of patients with kidney disease, and they cannot take any pain medications because that will further damage their kidneys. So when it comes to research, medication is recommended only in the very short period of time. Um, so worsening of symptoms when it comes to the back is associated with changes in activities. If people are stressed out or moody, without really further injuring their back. So if you lift something heavy and you have back pain, your back pain may get worse, but it's not because of the damage to the back. It's because you're just frustrated, or you didn't get a good night's sleep, or you twisted awkwardly just to irritate that a little bit more. Sometimes people will have these Theraball chairs. And when they sit on these Theraball chairs, they have a constant muscular activation of their abdomen and core muscles. And that is really not a solution to avoiding back pain because, again, if you are in the best posture there is for a prolonged period of time, you will get some back pain as well. So these chairs are good for a little bit, but to sit all day in a chair expecting that the back will be better, that's really not the case. So really, what's key is movements in all directions are really, really good for the back. And when I see patients with back pain, they can't move in one direction or all directions. But very rarely do I see patients that have back pain that can move really, really well because back pain is associated with decreased range of motion, increased tension, and people do not move in directions because they're afraid of pain. And sometimes that direction does give them pain. So movement in all directions is really, really good for the back. Some of the clinical recommendations for back pain is if somebody does get back pain, you want to continue the daily activities despite having the pain. So if you have to do something that, in your routine, you want to do that, but you want to modify it so that you're not in, lots of pain. So let's say you get some back pain, but you got to walk your dog for 45 minutes. Well, go walk your dog for 20 minutes instead of 45 minutes, but still get back into doing stuff. And then what everybody is doing here is we're getting educated to understand how the back works. And I'm telling you, exercise is really good for the back. And then when it comes to a glad back program in general, we show people these exercises to help them strengthen the back, the abdominals, the core muscles, as well as the hips and knees as well. And I'm a chiropractor. I see lots of patients that come and see me for treatment. I saw a guy not too long ago, and I said to him, "When did your back start?" He says, 38 years ago. Well, it's, it's a long time. But I saw another person yesterday said to me, I was working under my car last week, and I had to lift a tire, and now I have back pain. No problem. So manual therapies, physio, chiro, massage, acupuncture, things like that generally help with acute back pain as well. And then, sometimes people will, they'll change a tire, they'll get back pain, and they'll say, "Oh, I need an X-ray right away." That's not the case. I mean, if they went skiing and fell and they hurt a crack in their back, that's a different story. But in most cases, we don't need imaging right away. And then pain medications such as Tylenol, non-steroidal anti-inflammatory drugs, and opioids. You want to take that as little as possible, but only after very careful consideration. So we don't really recommend taking a lot of pain medications for back pain. Movement is probably the best. Movement and ice when it comes to acute back pain. So why do we exercise? I promise I'll be quicker around this to get to our questions. So why do we exercise? Well, it's really effective in reducing back pain because these mechanical receptors get activated and people have less back pain. When we exercise, it contributes to a lot of use of the back, so different movements of the back, which is really, really good. It helps self-manage people's back pain when they exercise, and it provides their kind of physical experience about what's too much and what's too little for the back. When back doesn't have the experience what's too much and what's too little, it can always guard itself, and it's easier to injure it. And then there's a lot of benefits of exercise, mobility and strength, but mood is a big one. Like if you have the right mind space, you tend to get through bouts of back pain a lot better. And then if you have general better health, great. We saw this at COVID too. People that weren't, didn't exercise as well. They went through COVID a lot tougher than those that have an active lifestyle. So and that same with the back. People that have better general health, they get through these things a lot better. I don't want to go into too much detail about the exercise, but here are some of the exercises that we do to strengthen people's backs and core. And like I said, we do that twice a week for 6 weeks for an individual basis. So we have people of all ages there. We do the exercise to strengthen the both abdominals as well as the back muscles, and also the hip muscles because the core is the abdominal pelvic region, and it's very important in general back health. So, if I can summarize this quickly, benign back pain is very common and not dangerous, but it can produce a lot of pain. It does provide a recognizable good and bad periods, but it doesn't really get worse over time. The back pain rarely comes from one particular structure, and the cause can rarely be seen on imaging. And then the strong is very back. The back is very strong, and misalignments and bad postures are quite common. And back pain can be improved by education and exercise, which is why we teach the Glad Back program. Again, this is how people can get in touch with me. You can send me an email. You can call my office, and we can schedule a free 15-minute phone call. But if you're in the area, if you want to come by and introduce yourself, I'll be more than happy to chat with you in person as well. Okay, does anybody have any questions now?
I have loads while we're waiting for our participants to maybe come up with some. I just found that you mentioned a bunch of very interesting concepts, and one of them was variety is really important. Can you explain a little bit more about why variety is so important and why we need to be looking for so much different movement in our backs?
So when people have a variety of movements in their back, the back goes, "Hey, I can go in all these movements relatively pain-free, and I'm comfortable there." But when people do not have a big repertoire of movements, they'll find that if they go into a particular movement, their back can actually protect itself. And basically, what it does is it can start to hurt or go into a spasm. But when the back knows that these are safe movements to go in, then people have a lot less back pain. And sometimes, if when people have back tension or they don't have a lot of range of motion, they will load that back with the lift, bend, twist, and then all of a sudden their back will be strained or go into a spasm. So the more mobility one has, the better. And the more mobility a back has, the more comfortable back is with those movements. But if the back is uncomfortable, it's because it's trying to protect you. If you go into a movement where you haven't been in that movement for years and years and years, back will go, "Hey man, like this is not where you want to go. We need to protect you. Let's start tightening your back so that you don't go into that and we can save you." When in fact, it's kind of not doing you a good service, but it's protecting you.
And the other thing you mentioned was that, basically, and I'm paraphrasing here, that you can have the best posture in the world, but you can still get a bad back if you're sitting at that desk for an hour with that great posture.
Yes. So prolonged periods of sitting or standing can give back pain. And really, what it is you overuse the tissue. So if you're standing on concrete floor, and if you're standing for a long time, you're putting pressure into a certain areas in your back. But when you're sitting, you're also putting pressure onto certain areas of your back. But those two areas are different. So when you offload and unload, you give some tissue a rest while you use other tissues. So when people are sitting, most of the force of their body is transmitted through the lumbar spine. But when people are standing, most of the force is transmitted through the sacroiliac joints. So people that stand a lot, they'll get sacroiliac joint problems. And people that sit a lot, they'll get lumbar spine problems. But people that transition between sitting and standing, they'll get less of both.
So even during this webinar, you should have been up a couple of times, or at least standing while you were watching it for a while.
Yes,
Yeah.
I was jittery around here a little bit, trying
Yeah,
to move a little bit.
exactly. And
Yeah.
then the other thing you had mentioned, well, just talking about that, you often hear that phrase now, sitting is the new smoking. Do you agree with that, that it is that big of a problem with society?
Yes, because prolonged sitting not only is bad for the back, but also general health. Like you need to get up and move and use your circulatory system and pump your heart. But in inactive positions, you basically are doing not doing your body a service. And if we just think of sugar sensitivity, blood sugar sensitivity, the more you move, the better that system becomes. But the more you are inactive, the more likely you are to get diabetes. And same with the back. The more you sit, the more likely you will develop, some back pain. But also, the more you sit, you also may get more of these chronic diseases as well that are associated with inactivity. So we got to get people moving around. And sometimes I see patients who exercise a lot. Let's say a lawyer comes to me and says, "Hey, I exercise 2 hours in the morning." I go, "What do you do the rest of the time?" "Well, I sit in my office chair for 8 hours." I say, "Well, there's your problem. Like you gotta break up that prolonged periods of sitting with periods of getting up and moving around. That exercise is great, but that just stint of sitting for so long is not really."
That is such an excellent point because I think that describes many of us that, get our run or our walk or something in and then sit the rest of the day. Super
I mean,
important point.
that's better than nothing.
Yeah,
Don't
but
get me wrong. That's continue, but know that prolonged, sustained posture will will result in more back pain.
and you also mentioned, I saw some of those images there, the importance of doing core exercises. Are there any you could recommend to us that would be the best for back pain and strengthening your back?
So if anybody knows so there's two forms of exercise for the back. One is mobility exercise. You want to increase your mobility of the spine. And the other one is strength or endurance, basically. But I would say probably the best exercise there is the cat-cow exercise. And cat-cow exercise is when you're on all fours and you kind of arch your back up and then arch it down. And really, what you're doing is you're putting motion into your lumbar spine so that it has more motion. And then when you have more motion, generally you have a lot less back pain. So people that sit in the office all day long in their chair, doing a few cat and cows throughout the day will actually improve their back pain quite significantly. And then sometimes people will get back pain, and when they do get back pain, they start doing a little bit of cat cow. And really, what they're doing is they're putting motion into their back. One way when they have back pain, one way or one direction will give them some pain, and then the other will give them some tension. So you wouldn't want to go into full pain, but you want to feel a little bit. But my point is, the more movement you put in that back via cat cow, the better.
Yeah. And they're so wonderful to do. You can do them, while you're on Facebook, while you're watching TV. It's just something
Correct.
kind of
You
mindless
don't
that you
need
can
equipment.
do. No, not at all. How about planks?
Um, Planks are good. Um, some people can't do planks. They can do modified planks. One of the exercises of glad back is a plank, but it is there's four levels to every exercise, and that is more of a third to fourth level of exercise. Um, uh, Doing planks is good, but sometimes when you hold the plank for too long, that may not be the best for your back. And the reason why that is, if you are holding a position for so long, you kind of deprive that muscle of oxygen, and then that can actually tighten the muscle a little bit more. So planks are awesome for 15, 20 seconds, go into a little bit of relax, and then do it again. But to hold plank for 5 minutes, not the best idea.
That's great advice because sometimes myself, I'm guilty of that. I think the longer I do this, the better it must be. I got to go through that back pain that this plank is causing now. So good to know.
We have a
I
few
mean,
from our audience as well, if
Excellent.
we
Bring
can
it
jump
on.
to those. So I
yeah.
have one from Maureen. Thank you, Maureen. It says, could you explain sciatica in more detail? I often have pain in the lower right back upper hip when I walk for more than 5 minutes. If I stop for a few minutes, the pain disappears.
Okay, so sciatica is when a nerve in the spine is compressed or pinched, and then people will feel pain in the butt, in the thigh, in the calf, and in the foot. And that is because that nerve goes all the way from the back down into the foot. However, sometimes when a joint in the back is irritated, stiff, tight, doesn't move well, that can also produce what's called a referral pain. And that referral pain may go down into the leg as well. So when I see patients, my job is to tease out and differentiate between, is this a nerve-based sciatica, or is this a mechanical back pain that is referring into the leg? Now, people that have sacroiliac joint irritation, they will have pain in the back. They will have pain when they transition between sitting and standing. But exercise, movement, and walking will actually make it feel a little bit better. And the reason why that is when that joint in the back doesn't move well, when you actually move it, movement will actually give you a little bit less pain. If you have true sciatica, you have a lot more leg pain than you have back pain. And oftentimes, when you have the sciatica, when you bend forward, makes it feel worse. When you have this mechanical back pain, when you bend backwards, it will actually feel worse. And people with sciatica, they take months to recover, whereas people that have mechanical back pain, that refers into the leg, they recover a lot faster. But basically, sciatica is when there's a when there are symptoms in the leg. Now, it's my job to figure out, okay, from which structure is this actually coming?
Thank you for that, Dr. Josip. The next one is from Kathy, which says, what can I do to help my even short-term sitting? My 78-year-old back had OA in the sacroiliac joints, and my tailbone sticks out, makes dents on my sofa, and not enough meat on my bones there, which I can identify with as well.
So I told this one office worker, he goes, I can't get up. I just get focused and this and that. And I said, how about you put your phone somewhere where you get to get up and actually get it? And then I said, how about every half hour you take a pencil? I don't have a pencil right now. I have my daughter's makeup thing. Uh, but if you take a pencil and chuck it in the corner of your office, get up, move around, and then put it back. But if you're at home and you need something to do, every half an hour you can get up, go to your washroom if you need to use the washroom. But if you don't, maybe touch the sink and go back to sitting. Like try to integrate things in your life that makes you get up and move around. If you're watching TV, put the remote control somewhere where you have to get up and walk to it and come back to it. And that will make you, or if you're drinking water or tea, I know it's nice when you have it right next to you, but have it a little bit away from you so you can get up and move around. If you do those things throughout the day, where it naturally makes you get up and move around, that's really the key. The movement is really the key to avoiding back pain.
And so if anyone else would like clarification, or Maureen or Kathy, if you want any further clarifications on that, please type that in. And we have another one asking, what causes sciatica? And perhaps another reiteration of how do we help it?
So, what can cause sciatica? In most cases, it is that disc. And that disc is a jelly filled donut structure. And sometimes this jelly inside can kind of work its way through the disc, and then it can protrude. And in some instances, it can also leak out. This is not generally a one time event that happens. This is from years of doing stuff, and one day you kind of do something that broke the camel's back type thing. Another thing is sometimes you can have tension in your butt. And there's a particular muscle called piriformis muscle, and in some people, this nerve, sciatic nerve, either goes through the muscle or under that muscle. So if that muscle gets really really tight, then you will also have sciatica type symptoms down into your leg. Another thing that can cause sciatica is stenosis, or narrowing of these canals through which these nerves exit. And what can cause stenosis is arthritis. So if you have a lot of arthritis, it can cause narrowing of these little canals. So basically, sciatica is compression of the nerve, regardless of what the cause of that compression is, whether it's stenosis, whether it's muscular tension, or whether it's a disc that puts a little bit of pressure on that nerve. And these nerves are really close to these discs. So anytime a disc bulges out a little bit, it has the possibility of put a little bit of pressure on that nerve, and that nerve now goes into your big toe, and now you have numbness, tingling, electricity going down into your leg. And then sometimes when that happens, when you have that nerve that's irritated from the compression of that disc, if you cough or sneeze, you think you're going to die, because when you do that, you put too much abdominal kind of pressure, and then it can actually shock that nerve, and all of a sudden it goes all the way down. So anytime that I see patients, I'm always trying to figure out, is this the back or is this the leg? If it's the leg, what is it from? So if you are getting persistent leg pain, you should see somebody, no question about it. And if you're finding certain things help it, continue to do those things. If you find certain things make it worse, avoid doing those things. But if you're unsure, this can be a complicated thing sometimes. If you're unsure, you should see somebody that can correctly diagnose you. Because if I give you some set of exercises right now, some of you will actually feel a lot worse, and some of you will feel a little bit better. So to give the proper exercises we have to see the person and see what their problem is first before we just, you know, give out all kinds of things or exercises for these conditions.
Carolyn, do we have time for one more?
Of course. Our
Okay.
back brace is beneficial from Andre.
That's a good question. And I would say yes and no. And the reason why I say that is, let's say you have back pain and you're a mechanic and you got to do some work. Hey, put on a back brace, so that you can, do your job and feel a little bit less pain. But to wear that brace all day, every day would be a grave mistake. I saw a competitive soccer player who wore the brace for his back because 3 years ago he injured his back, started wearing it, and then didn't take it off, basically, especially during sport. And when he came to me, his back was in dismal state. Why? Because his back really relied on something external, and the back said, okay, I don't have to do anything. I don't have to be strong here. I have this external device. So it took me time to sort of wean him off that brace so that he can actually play his sport relatively pain free. And now he does. He still has it, and he says, what should I use it? I said, never. But let's say you have a tweak in your back and you need to put it on to feel a little bit better that day, maybe the next day for a few hours. Hey, no problem. But to wear it all day, every day, certainly not.
Good information. Any other questions for folks? Hearing none, I would like to say thank you so much. Once again, fabulous information. And the GLAD program is just so fascinating. I've been reading so much of it online and
Hmm.
learning a tremendous amount. And I have to say, had a chance to talk to a 74-year-old woman who went through the program with Dr. Batinić, and she has this amazing testimonial about it. And we'll be running that story next week about just the importance of movement and how beneficial movement through this GLAD program was for her, and just how accommodating everyone in the program was, and how it wasn't a scary thing to do, and how the movement helped her so much. It's just that same thing. Movement is medicine, right? Or motion is medicine, as they say. And if you can get some guidance along the way, all the better. So once
Hmm.
again, thank you so much, Dr. Batinić and Blair, for helping us out there. And appreciate all your information, and looking forward to the next one on that we'll be discussing more about pain and its the origins of it and the mental effects of it as well.